Welcome all to the Women's Health Program. My name is Zuhra Yunus. I'm your moderator. Karibu Dr. Sheila.
Asante sana. Habari za jioni. Leo tunaongelea menopause kama dada Zura alisema kwenye ukomo wa hedhi. Ideally mimi nitaongea kwa Kiingereza na kama naweza maswali nitachukua kwa Kiswahili na Kiingereza. Kwa hiyo nilikuwa nasema kwa muda mfupi tuongelee vitu vifuatavyo. Maana ya menopause ni nini? Kuna dalili gani na au symptoms zake ni zipi? Kuna matibabu au treatments za hizo symptoms za menopause na tutumie zipi? And then following that tuongelee kuhusu matatizo ambayo yanaweza kufuatana na menopause. Na ni vitu gani ambavyo tuangalie kama ni vya hatari au ni vitu vya kawaida ambavyo vinatokea na baada ya menopause. So I think the structure is supposed to be, we talk about definition, symptoms, treatment options for the symptoms of menopause, and what happens next following menopause, and what is normal or what is expected as normal changes following menopause, and what is expected as abnormal or something that you should get checked if you get any of those symptoms. As you know, definition-wise, as it's very self-explanatory, menopause, or it's the end of your menstrual cycle, menstruation. Ni mwisho wa kupata siku zako za period au za hedhi. They're defined as no periods for over 12 months. So kuna ile cut-off point ambao unasema lazima hujapata siku zako za hedhi kwa muda wa mwaka mmoja. Normally, average age ya iko kitu kwenye wanawake wengi ni anywhere from the age of 45 mpaka 55. Kwa miaka 45 mpaka 55. There are some women ambao wanataka kuingia premature menopause, yani wana ukomo wa hedhi kabla ya muda wao, and that is defined kama hedhi zao zikimalizika kabla ya miaka 40, before age of 40. There are other reasons why women may also go through menopause, and they may be secondary to surgery that they may have had, such as if they've had ovarian cancer, and that means both ovaries have been removed. Au kama umepata zingine kuna magonjwa kama vile uvimbe kwenye akili, or brain cancer, or brain tumor.
Oh, mommy.
Dr. naomba uji-unmute tafadhali.
Sawa, nimeona, sawa.
Yeah, sorry.
Nasema hivi kuna vitu vingine ambavyo vinafanya mtu aende kwenye menopause mapema. Hiyo nitakutana kama mtu anafanya operation ambazo zimeaffect nani ovaries zake, au watu wanakuwa na uvimbe kwenye ubongo ambao imeharibu ile communication au mawasiliano kati ya ovaries na ubongo. Kuna vitu ambavyo the latter case ambao kama mtu amekuwa matatizo ya ubongo au uvimbe kwenye ubongo, kuna dawa ambazo wanapewa kucorrect hizo. Dalili zake za symptoms za menopause ni nyingi mno, lakini wanawake wengi ukionana nao, hata ukiongea wanaweza the most common ones ambazo nitaongelea leo ni hot flashes, ambao watu wanakuwa wanapata joto, yani joto ambao halieleweki inakuja tu lenyewe. Hot flashes, night sweats, ile kupata joto na majasho usiku sana. Na najua kama Dar es Salaam na Tanzania wakati wa kipindi cha kiangazi joto ni joto hasa, lakini hili ni joto tofauti. Watu ambao wako kwenye menopause watakwambia joto hilo ni tofauti kabisa. Pia wanakuwa na irritability, mood swings, wanakuwa hawana raha, saa nyingine wanakasirika mapema mno, saa nyingine wanakuwa na wasiwasi au anxiety, na vitu vingine ambao wanaona ni vitu ambavyo hatuongelei kwenye society, kwenye maisha yetu. Ni vitu ambavyo wanakuwa na matatizo wakati wanakuwa hawana hamu ya kufanya tendo la ndoa na their husbands au waume zao. Wanaanza ku notice kama meno yao yanakuwa kidogo yanalengea, so loose tooth. They can see some gums receding, ngozi zao zinakuwa ngavu zaidi, so drier skin. Also kitu ambacho kinatokea ni kwamba wanakuwa na risk ya kuongeza magonjwa ya moyo, so wanakuwa na high risk ya blood pressure problems na stroke na diabetes. Maanake wanawake kabla ya muda wa kuingia menopause, ukiwa na estrogen wanakuwa kama vile wanakuwa protected na ile estrogen, wasipate magonjwa ambao wanaume wengi wanapata kwa muda wakiwa na umri mdogo zaidi. Kitu kingine ambacho wanaweza kuona wanawake wanakuwa na matatizo ya kuwa na control ya mkojo, kwenda kujisaidia chooni. Kwa hiyo wanakuta kama akikohoa anakuwa anajikojolea kidogo, au akiwa anajisikia atakuwa enda chooni kwenda kukojoa, anakuwa hawezi kujizuia, anataka akajikojolea. Ni kitu ambacho kinakuwa kingine cha aibu, na wanawake wengi hawaongelei vitu kwa sababu ni vitu ambacho they affect them and they feel very self-conscious, and it's not something that we share in the community, that you're incontinent of urine. The other thing that happens very common, ambacho can sometimes drive I said loss of libido, which is sort of sensation to wish to have sexual intercourse with your partner. And that sometimes is mostly driven by vaginal dryness and itching, ambacho ni kitu ambacho kinatokea mara nyingi sana. And of course, the other thing that we don't talk about ni kwamba wanakuwa na joint pain. Now, of course, they lose some bone density. Again, estrogen is very protective kwa wanawake ambazo hatuongeleagi mara kwa mara. Nonetheless, kuna vitu ambavyo we can do to make things better, ambazo kinatusaidia jinsi unapojisikia.
Dr. Sheila, before you go to that, can you just repeat that a little bit in English, just in case there are people who don't speak Swahili?
Okay.
Thank you.
So I talked about the symptoms that we see a lot in menopause, and those include what we call vasomotor, and these are symptoms that we can't really control. Things like hot flashes and night sweats, disturbed sleep patterns and insomnia, which is difficulty sleeping, or irritability, short-term memory loss, and poor concentration. Now, again, these all go hand in hand. If you're not sleeping very well, you're more likely not to suffer from memory problems and have poor concentration. Hot flashes is when you get sudden feeling of being very hot and sweaty, that and then that sort of goes away. It's very common. And night sweat is when you're dripping in sweats when you're asleep at night. The other things that are happening, obviously, is sexual dysfunction, which I've talked about. And that could be multifactorial. It could be because they're already going through a period of hormonal changes that can lead to a much more depressed mood and anxiety and being irritable. So they're not going to be feeling as if they want to be engaging themselves in any sexual activity with their loved one. There's reduced libido. And again, this is due to reduction in the hormone levels. And there's sometimes also pain during intercourse because of the vaginal dryness that I've explained. The other things that happen is urinary problems. And this is sort of inability to have better control of their bladder and when and how they empty it. So for instance, we talk about something called stress incontinence. And that to me is when women are unable to control their bladder. So when they cough or sneeze, they leak urine. And the other thing is called urge incontinence. It's when they've got this sort of urgency when they need to go to the toilet, they have to go, and they can't hold their urine or have better control of their bladder. And these could be multifactorial as well, but by all means, having less estrogen around menopause, that does drive those symptoms as well. Those are the areas that my area of interest, and hence why I think my colleague did introduce me as a person in urogynecology. That's what I normally specialize in, mostly sort of women problems post-menopausal. In terms of what we do about it, we can have some treatment, and I think most women sort of think it's a natural thing and they do nothing about it. and they just suffer. Sometimes it can take years for the symptoms to improve. And therefore, it is worthwhile, offering some treatment options to most women, because it will make them feel better, and it will make their life better, and it will make them a better wife, a better mother. As you all know, that they'll be functioning better at work, and they'll be less irritable. So, there is a bigger factor to it, rather than just, treating, or just dismissing it as women's hormones or women's issues. So we normally, as again, when women come up to see us with the symptoms around menopause, because symptoms do change. Some women can have just the symptoms and still have periods for a few years before their periods stop. There is a period that we call perimenopausal. So this is a period around towards the end of your menstrual cycles, whereby women get sort of irregular periods. So what I mean irregular is watu wengi wanapataga hedhi kila mwezi, lakini wakati wa perimenopausal saa ingine inaweza kawa wakamiss wiki, inakuwa delayed by weeks or months, na zikija zinakuwa quite heavy. So they get quite heavy periods, irregular, as they come towards the end of their menstrual cycles. And they are normally associated with a lot of symptoms. Now, one of the questions people may ask me is what would happen if people have had hysterectomy? Well, what I mean by hysterectomy ni watu ambao wamefanyia operation ya kuondoa kizazi chao. So these people, sometimes they don't have any bleeding. So of course they have no bleeding, they have no womb, so hawana kizazi, kwa hawana hedhi, lakini wanakuwa na zile symptoms ambazo nimeziongelea. Kwa hiyo we'll talk about the treatment options. Some of the treatment options also they depend kama bado kuna kizazi au hauna kizazi. And some of these symptoms can involve anything from psychological treatment, what we called cognitive behavior therapy. Kuna vitu ambavyo unavifanya mwenyewe kujisaidia mwenyewe nyumbani, like simple measures sort of to try and keep cool, keep your room cool, wear loose fitting clothes, to try and improve your sleeping, and all those things that you can do without having any major changes in your life. And then we talk about medication that we can use to treat some of these symptoms, and we'll talk about those in different ways. So first thing I want to talk about in terms of treatment is we can treat the number one treatment that people sometimes feel is the irregularity of the periods towards the end of their menstrual cycle. Again, in this what's called perimenopausal, whereby the periods are unpredictable, irregular, and often when they do come, they're extremely heavy and they last for weeks on end. And that's not unusual at all. Kwenye nchi kama za huku Uingereza, for instance, any woman who has quite a prolonged period and of a certain age, over 45, they do get extra investigations, which normally almost always come back, in 99% of people come back as nothing to worry about. And the investigation is to see whether they are having some changes, suspect of what we call cancer kizazi. Like in reality, it's just what happens during the perimenopausal period. So we'll treat it. It's two ways. You can try and wait it out. So people sometimes just wait it out a year. They're having very heavy periods. You can treat it until the signs that you give them iron tablets, for instance, or you give them tablets kama tranexamic acid kupunguza ile damu inayotoka wakati wakiwa wanapata hizo siku zao za hedhi. Other times unaweza kuwapa vitu ambavyo vina kitu kama coil au kitanzi kinaitwa Mirena ambacho kidogo kina hormone ambacho kina hormone ambayo inafanya kizazi kisitoe damu nyingi. And that you can leave it in for 5 years. So you leave that Mirena coil for 5 years. It's a very good treatment. But for the other symptoms, some women will not mind much about the bleeding, but they want to be, what really affects them is the symptoms that they get around it. And apart from giving simple advice, you can also talk about whether you can give treatment, what we call HRT, which is hormone replacement therapy. When it's during the time when we call perimenopausal, you can give what we call cyclical hormone replacement therapy. And what I mean by that is, unawapa vidonge ambavyo they take it for 21 days, and then they have a break, and they will have a bleed, like a normal period, and another one. And you can do that for a while, for about a year. And then normally the doctor will check zile hormones za wanawake ambazo zinaitwa FSH na LH, kuona kama vile hao wanawake wameingia kwenye wameshaingia kwenye menopause. Kama hiyo haiendekani vizuri, watu wengine wanaweza kuwapa kitu ambacho inaitwa kila siku unapata menopause, unakuwa na kidonge kila siku. Hiyo inasaidia kwamba ina replace the reduction in the hormone levels that you get. And HRT comes in many forms, and it can come in a tablet, it can come in a patch, which is what most women prefer, and they can put a patch on, which can last a day. Sometimes it can be a few days, and they come in a different way depending on what suits you best. The other most treatment people can give is tablets ambazo zinatreat sort of psychological symptoms. Kuna duloxetine ambayo tunatumia mara nyingi sana, inasaidia kwenye zile mood swing na irritability na anxiety na matatizo ya kulala. But one of the added benefits ya kutumia duloxetine inasaidia kwenye watu ambao wana matatizo ya watu call stress incontinence, ile ambao ikohoa au wakicheka wanajikojolea kidogo, inasaidia hicho pia. You don't have to have any treatment by all means. Some women are quite happy to kind of wait that time, because you either wait and the symptoms get better gradually and you learn to live with those symptoms or not. The other thing is lack of libido, which is can be quite profound, and we treat that. Some women do want treatment, and you can give a small dose of testosterone to increase their sexual drive and their libido. But one of the most thing that women always complain is a dryness, vaginal dryness. And that vaginal dryness, it's quite easily treatable, and it can have a remarkable improvement in a number of symptoms, apart from just improve their sex life, and it can also improve their urinary incontinence. And also later on, which I'm going to talk about, is symptoms that come after menopause, something called a prolapse. And those are the sort of main sort of treatments. Is you can either treat conservatively with not doing changes within your lifestyle, what you eat, avoid spicy foods that can make you feel more hot, eat more fruit and veg, keep cool, exercise, all of those things that make things your life better. Or you can have treatment, which can come in terms of hormone treatment, or you can have non-hormonal treatments, which are the options that I've talked to you about. The next thing I wanted to talk about following what happened after menopause is it's the things that happen that women don't talk about, and nobody, I think it's not only I presume, people don't talk about it in the UK. I presume it's probably the same and probably worse back home in Tanzania, because it's embarrassing. It's not one of the things that women want to discuss. And this is when women have weakness in their pelvic floor.
Yes.
And it becomes more profound and more and almost more prominent once you've gone through the change. You find that the vaginal walls, so that the skin ile ngozi quite a little bit more lax, because haina estrogen, so people get something what they call a prolapse. And everyone will ask me what a prolapse is. And a prolapse is a symptom of weakness in the pelvic floor. Mostly it's following childbirth. Lakini it's actually just because women have carried a baby. I think that's the most, the highest risk is being pregnant, and then having a vaginal delivery. This is a second risk. But also there is a component of, women of color, so African Americans, as well as Asians, have higher risk of having weakness within the pelvic floor. And that's genetics that I can't particularly explain. And this is when you get your bladder coming down through the vagina and pushing through the vagina. So you get kind of a little uvimbe in the area in the vagina. And this can be in the back of the vagina or the front, or katikati, inside the vagina. You get a pulling sensation where the neck of the womb, our cervix, has come down and is protruding on the outside, or sometimes can be on the outside. And these are symptoms of the things that we can get post-menopause. Again, this is because estrogen does have a protective property to the vaginal wall, and lack of it makes it likely that it's going to stretch and it's going to make things a bit more lax to come down. The treatment options for that are normally we can replace.
1 second, Dr. Shayla, 3 more minutes.
Okay.
3 more minutes, yeah.
So we can give some estrogen cream, which is what I've talked to you about. And we can talk about exercises to strengthen the pelvic floor. And so the pelvic floor, when someone asks, what is the pelvic floor? The pelvic floor are the muscles that control your control how well you control your bowels, how well you control your bladder. So ile misuli ambayo inafanya wewe uweze kwenda chooni sawa sawa. Kama unaweza kusukuma kwa chooni, ni ile misuli ambayo wanawake wanatumia wakati wa kusukuma wakati wanajifungua pia. And that's what your pelvic flow is. So you can have some pelvic flow exercises for that. The things to worry about, which is the last thing I wanted to talk about before, postmenopausal. Women should not have any bleeding after menopause. Kwa hiyo ukishakuwa umeshafika ile, once they finish their bleeding after 12 months, if they do have more bleeding, after a period of no bleeding has happened, it is worthwhile having an investigation. Now, naelewa kwamba resources are slightly different, but it is important to have an investigation, because the bleeding could be an early sign of cancer of the womb. That is one of the most things that we want to make sure that we can avoid, because most cancer of the womb is normally caught very early, and the treatment is very easily done by removing the uterus and mostly the ovaries, so that it's easy to get that done. The second thing is, wanawake wengi kwa nchi yetu Afrika wanakuwa na uvimbe kwenye kizazi, what we know as fibroids. Fibroids, again, should not be growing after menopause. So hawana ile drive estrogen to make them grow. And if they are growing, that's also a reason to get checked. Especially if you feel kwamba una uvimbe kwenye tumbo ambao unaendelea kukua, it's important that you get that checked and have scans, and that can easily again be treated by a simple operation. I welcome any questions, and I know there's a lot. I didn't have a PowerPoint, but I thought I would talk through.
No, you did great. Thank you very much. And there are a lot of questions.
Okay.
So as I explained earlier, you can write your questions, which I will read out right now. And if somebody wants to ask herself or himself, you can raise your hand. And you can ask Doctor. So Dr. Shayla, let me read you the first question. You relax, I do that for you.
Thank you.
So we have Emson Shirima, who said, so as we said, we speak both languages, English and Swahili.
Yeah.
So if you ask your question in English, it will be answered in English as well, but you can just summarize in Swahili, Dr. Shayla, please.
That's okay, no problem.
Okay. So Emson is asking, any chances that that women may still get pregnant after being in menopause? So in brackets, it says 1 year of absence of periods at the age between 45 and 55 years. Should I repeat the question, or did you?
No, I got the question.
Okay.
Yes, they can still get pregnant. It is, it's not something, it's not common, but it's not unheard of. Especially women who have always had irregular cycles. So I'm talking about women who either had history of polycystic ovarian syndrome, or have always had irregular cycles whereby they go months without having period. There are women who only have 2 or 3 periods a year, and therefore they may go a year without having a period, but actually they haven't properly gone through the menopause. because their periods have always been irregular anyway. So it's quite difficult to know whether they've gone through the menopause or not. For this particular group of women, there is every chance that they are still, they haven't properly gone through the menopause, and therefore they could get pregnant. The second group of women is the women who go through premature menopause, and these are women who they lose their periods for probably a year or two, and they've had a blood test that shows they could be menopausal, and they've been told they can never get pregnant again, and that their chances are over, and whatever happened, the body decides that actually it's not going through the menopause. And it may be sometimes through stress related, the drive from the brain to the ovaries is interrupted, and therefore they're unable to ovulate properly, and as a result they end up in a state of premature menopause. So there is a small chance.
Okay, thank you very much. Magdalena nitakujibu. Asante, anasema asante kwa mafunzo haya. Inawezekana kupata mawasilisho haya kwa kuwa inarekodiwa? Ndio, inawekwa kwenye website. Ngoja nifikirie, lakini website hiyo ya East African Education huwa wanaweka vipindi vyote hivyo. Hiyo ni kwa Magdalena. Alafu Candy Muze is asking, what is the dose of testosterone used to increase libido, and for how long is it advisable?
So I will get you the dose. Just give me 2 minutes. I don't always remember the dose these days, because most people don't ask for it. But you can have it for as long as they need to have it. So that's the first thing, because everyone worries about it. So you can give them for as long as they need to have it. And if because not everybody. One of the reasons is most women will want that because they are in a relationship. And also you're forgetting that as the women get older, their husbands also get older, and they also have other medical conditions, and therefore how often they're required to have, to continue to be sexually active is very variable. And therefore they may need to have testosterone for a short period of time, and then they may no longer need it. I will remember the dose and I will write it down if you give me 2 minutes, if that's okay. I need to kind of
no problem. While you're looking for it, can you just repeat that in Swahili, please, just in case?
Kama wanawake wanahitaji kutumia testosterone wamepoteza hamu ya kufanya tendo la ndoa na partners wao, unaweza kuwapa testosterone. Umenuza kwa muda gani? Unaweza kuwapa kwa muda ambao huyo mama anahitaji kutumia hiyo dozi. Haina mwisho, na inategemea yeye mwenyewe anaitaka kwa muda gani. So kila mtu ni tofauti, and therefore kwa sababu wako tofauti, wanawake wengi kwa muda huo wanakuwa ni watu ambao kidogo ni umri umeenda, na waume wao pia umri wao umeenda. Kwa ile kufanya tendo la ndoa sio kitu ambacho wanafanya kila siku, na kitu na wao wanaume wanakuwa na matatizo yao pia. Kwa hiyo inategemea wanahitaji kwa muda gani, na saa ingine inawezekana wasihitaji kwa muda mrefu.
Asante. Asmahan Abdullah is asking, how long does the pre-menopause period last?
It is variable for every person. Most women will start to report having some symptoms related to menopause sort of about in their 40s, and sometimes this may continue until they go through the menopause, which could be in their 50s or even up to mid 50s. So there is no particular deadline, and there's no particular length, and it is variable depending with everybody. It is a matter of just, I think we're all different. I think all women are different. Like some women start their periods at age 10 and some women start period at age 16. And I think it's all very different, and it's very variable.
Okay, Candy Muze again is asking, any advice for treating vaginal dryness?
Oh yes, there's plenty of advice. So what exactly? So we can treat it by 2 ways. I mean, you can use, there is a lot of vaginal, so there's hormonal and non-hormonal methods of treating vaginal dryness. But sometimes it's one of the things that most women go through, and especially in our cultures, most women tend to wash inside the vagina. And that's a cultural thing that they've been doing forever. Now, when you go through the menopause, washing inside the vagina for whatever reason means that you're going to wash away everything. So that most women, they have 2 problems. They end up with having thrush, and then they have dry vagina. So they have vaginal dryness from being in the menopausal status, and then they have thrush, which makes the problem quite worse. So one of the things we tend to kind of encourage women is not to use anything inside to wash, and just to wash the outside with just water and nothing else. And if they've got thrush, we will treat thrush. And then we encourage them to use a vaginal moisturizer. And that can be a vaginal moisturizer with a little bit of estrogen, a very small dose, or one which has no estrogen, which some women may be best, especially if they've got history of breast cancer or ovarian cancer, they may want to stay away from anything with estrogen. But yes, you can treat that.
Can you respond that in English, in Swahili as well, please?
Okay, so vaginal dryness, I can't say that really in Swahili, it's a lot harder.
Yeah, just explain the rest. I think.
So unaweza kutumia, kuna lotion unaweza kutumia kwa ajili ya vaginal dryness. Ziko za aina mbili, ambazo zina hormone, ambazo hazina hormone. Lakini kitu ambacho watu wanafanya mara nyingi, wananawa na maji ndani ya uchi. Wanatumia yale maji, wakiwa wanachamba ndani na maji pia. Kwa hiyo wakifanya hivyo, unakuta wanakuwa na ugonjwa wale, wanakuwa na thrush kama ile fungus wanapata ndani ya uchi. Kwa hiyo inafanya ile dryness au ile ukavu, na ule ugonjwa wa kuwa na thrush inafanya vitu inakuwa more painful au inakuwa. Kwa hiyo kisha kwanza unatakiwa ufanye, wanawake wanatakiwa wasinawe ndani ya uchi na maji. Kama wanasafisha nje tu kwa maji. Alafu cha pili, kama wana fungus au thrush, wanapewa dawa ya kutreat hiyo. Kwa hiyo dawa za thrush ni rahisi sana kupata. Zinakuja kwenye cream, zinakuja kwenye tablets za kumeza, so dawa za kumeza kama kidonge. And cha tatu, unapata lotion kama ya moisturizer. Kwa hiyo ni lotion ambayo inaingia ndani ya uchi. Na hizo lotion zinakuwa haina hormone au inakuwa na hormone pia. Hizo tubes au inakuwa kwenye tube, inakuwa na kitu ambacho kinaitwa applicator, au kitu ambacho unaweka hiyo lotion kwenye kama kasindano hivi, ka syringe, alafu unaweka hiyo syringe ndani ya uchi. Na hiyo unafanya hivyo tu, na hiyo inakuwa no treatment option.
Pole sana. Pole. Nadhani limeeleweka. Asmahan Abdallah is asking again that can myoma get better with menopause?
So yes, technically. Yes. Leiomyomas do get better post-menopause. But again, in my experience, women I see that are African with leiomyomas, they really never really shrink the same way that our Caucasian counterparts tend to do. They still remain quite big, but what we tend to kind of rely on is they should not get bigger. But if they are getting bigger, then that's a cause for concern.
All right. Pole, unataka kukohoa kidogo?
I just wondered if I've answered the question.
Okay, unaweza kulisema kidogo kwa Kiswahili kwa kifupi?
I mean, ilo swali la myoma ni kama fibroids, kama kuongelea uvimbe kwenye kizazi. Ameniuliza kama zinapungua au, na nikasema kwamba mara nyingi ukishafika menopause zinaanza kupungua au zinakuwa shrink, kwa sababu hazina ile estrogen ambayo inafanya zikue zaidi. Lakini kwenye experience yangu mimi, wanawake ambao wanatoka kwenye Afrika wanakuwa na mauvimbe yanakuwa makubwa sana. Kwa hiyo mara nyingi sana huwa hayapungui kama tunavyotegemea kupungua, yanakuwa either yanabaki kwenye size hiyo hiyo, au kama ikianza kuongezeka then tunawaambia kwamba ni bora wafanye operation na kuondoa kizazi.
Asante sana. So you can still write your questions or raise your hand. Emson, anybody who has a question, yoyote ambaye na swali unaweza kuuliza kwa Kiingereza au kwa Kiswahili kwa kunyoosha mkono au kuandika kwenye chat. Emson anauliza, Emson is asking, menopause and fragility fractures, in brackets low energy fracture, what's the reason and the role of gynecologists in prevention of this?
I do laugh at the role of gynecologists. So we don't particularly, so I think that's one of the things. I don't think anyone have really thought about what is the role of us as gynecologists in preventing those low grade fractures. So one of the things that I think that anybody with a low grade fractures, one of the things they should do, they should get some investigation. They should look at calcium levels, and look at the vitamin D levels, just to make sure we're not missing anything. I think one of the things that easily missed is we expect some menopause changes, but it tends to be that tends to happen quite later on. If you're going to have fractures of the big bones, you probably are looking at women in their sort of 70s, 80s. It's not something that you want to see in a 60, 70 year, 60, 50 year old who's gone through the menopause, because they'll still have quite a significant bone density, and they shouldn't expect that. So if I'm having low-grade fractures in women in their 50s and the 60s who are menopausal, I would encourage to have investigation to make sure they don't have other causes for it. And one of the most common thing is they may very well have cancer of some sort that is not estrogen-driven, that's causing it. So we have to make sure that we're ruling that out. But in terms of what the role of the gynecologist is, again, this really depends on what women want. I'm of the opinion that it depends what I do is mostly driven by what my patients want me to do for them, and I give them that choice. There are things I would recommend. So if they've got cancer, that's slightly different. But if it's about their quality of life, then it's really what they want. Most people don't like to take tablets, and they would like to stay away from it if possible. I think if you could have estrogen replacement therapy and you can tolerate it, it's well worth giving some women that, and they may very well it may be protected for them for a little while. Bear in mind, so this is one of the things that I always say, that if estrogen on its own is what we call unopposed estrogen. So if they're having estrogen replacement but they're not having any protection, they still have their womb, then you increase their risk of having cancer of the womb. So if that's the case, then you have to think about whether you want to balance the estrogen that you're giving to the women. But if giving women estrogen is one of the things that we could do as gynecologists, or I'd call HRT, in preventing that, and that's probably the only thing. But importantly is encouraging women to continue to have a healthier lifestyles, to exercise, especially weight, lose weight, because you've got more weight on your bones, then more likely that they're going to fracture. They're going to have, the body can't carry on like that. And also strength exercises. So I know most women don't like to lift weights, but as a matter of fact, weight exercises and weightlifting is quite good to build bones. And to bring the structures around the bones, the muscle, the ligaments to get stronger, to support the bone structure. I'm really sorry, I have a cold, so I've been coughing for a few days.
Take your time.
So somebody asked me about testosterone.
Yeah, earlier you responded to that, I remember.
So you can give, for those who ask me about testosterone, you can have testosterone replacement, and it comes as a gel, 1 to 2% testosterone gel, which the women can apply, and that's absolutely fine. And it just comes in a percentage according to what else is in it. So it's 1 to 2%.
All right, thank you very much. Joycelyn Tam, I'm not sure whether this is a question or she was responding. It's just a statement, I think. She says, in sexual health clinic, we recommend for women to use Aqueous cream as soap.
Yeah, that's absolutely fine. I completely agree. Yeah. But the problem is, so I think one of the pitfalls of menopause, or actually just pitfalls of everything about women health. So I'm not talking about just about menopause, but it's a fact that most women tend to clean, and they overly clean down below. A process called douching. So you put water in, and then unachamba na maji, and then unaweka maji ndani. But the problem is that just makes the problem worse. Then you start to have a smell, and then you wash some more, and the smell gets worse. And the problem is, it's one problem perpetuates the other. So the more you wash, the more the smell, and then the more you wash. So it becomes a big problem, so ongoing. And therefore, just using Aqueous cream for the outside is quite good. It's also a barrier cream. So for those women who are having little urinary leakages, it will protect the skin around it, and it will make them not have the smell that they worry about. So it's quite important. The other thing.
Okay. So Nuru said, sorry, I missed the beginning of the session. Was there any presentation listing the symptoms common in Bame, or are they almost similar to the Caucasians?
I think they're very, very similar, but one of the things that particularly happen in people of Black and ethnic Asian ethnic origin is hair loss. That's the bit that we don't talk about. I think there is a big proportion of Black women who tend to lose quite a lot of their hair around menopause, more so than Caucasian women would. But it is, I think, hot flashes and the rest of them are just similar. But hair loss particularly, I think, affects Black women a little bit more than our Caucasian counterpart.
All right. It jumped. Sorry. Asmahan is asking, what is the cause of irritability in menopause? Can it cause extreme mental health problems to require treatment?
It depends
Can you respond to that in both languages, please? I think.
I think it depends what she means by extreme mental health problems. So I think there's two parts to it. So I'm going to answer the first part. So irritability to menopause, it's probably a number of reasons. And I think it's all to do with the changes, the hormonal changes that happen. I think some women who perhaps have what we call PMT, so, premenstrual stress syndrome. Again, it's similar kind of pathways. The things that happen during menopause that can cause increased irritability, it's, the hot flashes, the night sweats, the sleeping disturbances, because obviously they're having night sweats, so they're up all night, or they're feeling too hot, they can't get comfortable, the joint aches, and therefore lack of sleep, not feeling comfortable, in discomfort, all that can lead to irritability, and also the hormone imbalance can lead to irritability. In terms of can it cause extreme mental health, I think if you already are a sort of person who have poor support and are predisposed to having a severe mental health, because you can become quite depressed, and that can lead to a psychotic episode, because depressed people can have psychotic episodes as well, and that can lead to extreme to a severe mental health crisis. Ameniuliza kitu gani kinafanya wanawake wanakuwa kwenye mood mbaya wakiwa kwenye mwisho wa hedhi zao. Nimejibu kwamba hiyo inatokana na vitu vingi. Zile dalili za menopause zenyewe kama vile kutoka majasho, kutolala, kuwa na ukubwa na viungo, hivi vitu vinachangia vote kufanya mtu asilale vizuri. Kwa hiyo anakuwa hajisikii vizuri, kwa hivyo anafanya mtu anakuwa mood yake inakuwa so nzuri. Akaniuliza kwamba hivi, kwa hiyo kama mtu kama hivi inawezekana akapata ugonjwa wa akili ambao unahitaji mkali sana, ambao unahitaji matibabu zingine kwenye hospitali. Nikasema ndio, kwa sababu watu wengine wakiwa bodi yao imekuwa chini sana, wanataka wakapata almost watu kwenye Kiswahili wanataka kama kile kichaa, watu wanakuwa wanaona vitu ambavyo haviko pale, anajiongeleza mwenyewe, anakuwa hana hamu ya kula, anakuwa hana hamu kufanya chochote, anakuwa anajisikia vile anataka kufa. Vitu watu hivyo vinafanya mtu lazima apate lazima aende kutafuta watu wengine, watu ambao wanamuona wamsaidie kufanya matibabu. Matibabu hao inahitaji kama inakuwa matibabu inakuwa ya mental health first, lakini kama inakuwa driven na ile hormone, kumpa mama kitu kama HRT inaweza kumsaidia pia.
Asante Dr. Frida Mole. Niliona Agneta Kamugisha, you raised your hand. Ulinyosha mkono, naona umeshusha. Do you still want to ask?
Someone was asking about natural remedies to calm down.
I know. Before that, Dr. Shayla, please. Yeah. There was somebody who raised their hand. I was just asking whether they want to ask. I will read that for you. No worries. Agneta, do you want to ask?
Okay, yeah, I dropped my hand because I needed to find the name of the drug, which I just did. I have a couple questions. One is I hear people talking about is Primatene, ambayo wanasema inatumika kwenye kama huko chini kumesinyaa. So,
inaitwa nini, sorry?
Primatene. I will paste it in. Yeah.
How do you spell it? Sorry.
Let me just, give me a second. Let me, I just found it. Give me 1 second.
Okay, while
okay, I just put it in the chat.
Okay,
Primatene. Okay, so my question is what I hear, and I just haven't, because I have not used it yet, because I actually don't have the symptoms. But they're saying that it is a strong sexual arousal. When I Googled it, I did not see any of that.
No, it's not.
Huh?
It's not. So Primarine is Primarine in an estrogen cream.
But they're using, but I'm being told that it is a highly a sexual. That's what I'm told. No, so I just wanted, and that's really one reason I'm on the meeting today, to ask about this experience. And now again, I've heard from, I haven't used it myself.
Okay.
So I just wanted to hear from a doctor or from somebody from the health field about the cream. And so I was actually very excited when I saw this meeting. So that's one thing.
Okay.
My other I guess a kind of question or comment. I suffered from in my 50s, I suffered from cysts, breast cysts.
Okay.
I mean, I had severe cysts. They had to be aspirated and so forth. Okay. Then I was given a drug, and I was trying to find this drug, which was had very strong side effects. I stopped the drug. Then I ended up taking some kind of anti-cancer drug.
Okay.
And after that, everything stopped. Everything stopped, including the cysts.
Okay.
So I did not go through. I'm almost 60. I have not had all these things like hot flashes and things like that. So I'm hoping at some point they'll come, or maybe it was because of the drug. But I just, that drug, and I don't have any other problems as far as, mambo ya kusinya, I don't have any of that yet. I would say yet.
It's not for everybody. So so majority of women may have that, but there is always, it's an exception to the rule. There are always people who won't have the same effect as everybody else. So that's the first thing. Generally, I think majority of women will have some sort of symptoms. Some will be very severe and that they may require some treatment, and some may not actually have any, and they may not recognize when they go through the menopause and their periods will just stop. And that's also okay. Not everyone will have the same. And I think that's one of the things that we should all accept, that we are all very different and every woman's experience will be different. In terms of the vaginal cream that we call the estrogen cream, the estrogen cream is great. I recommend that, and I tell women to take that. Even my 90-year-old women have been prescribed that, even though they're not having sex. It's just to have good, healthy vagina. That's all. That's my job. So it doesn't matter what, most people worry about it. I think, I said, at the end of the day, having a healthy vagina means you're going to have a healthy bladder. You're not going to have a lot of UTIs. That's the other thing that people don't talk about. Having a dryness in the vagina, irritated vagina, brings you having more irritated bladder, and more likely that bugs are going to travel up your through the urethra into your bladder to cause UTIs. And so it's important to have good vaginal health, and Premarin is a good estrogen cream that I would always, I would recommend. If you're going through anything after menopause, you should have it, and all women should be on a estrogen cream, as far as I'm concerned. But that's my opinion.
Well, thank you so much. Excellent program. Thank you.
Okay, that's good.
Thank you, Agneta, for those important questions. Freedom Molel is asking, and we're running out of time. If you don't mind, we'll add a couple of minutes, Dr. Shayla.
Okay.
Because I can see there's still a couple of questions. So Freedom Molel is asking, are there natural remedies to calm down premenopausal challenges?
Absolutely. There's many. There's like loads of things people can do. Lavender oil, primrose, I've got evening primrose oil. Things like, there's loads of things people can have that they can calm down any of those symptoms, as long as you remember to mention them when you go and see your doctor, because some of these, there may be natural remedies, but they may interfere with some other medication. So people always forget when they go and see the doctor, when we ask you, are you taking any medication? But actually what we want to know is, are you taking anything at all, anything that improve your health, because some of those may have side effects. But yes, evening primrose oil is my favorite, and that works like a charm. It's really, really good. A lot of people are taking it.
All right, fantastic. Mwanaisha Kejo is asking, I just want to know, what is the possible age to start menopause, which you did mention earlier, but you can just repeat that. And is it normal for the woman to get heavy bleeding during this period? She came in a bit late, so
okay, that's okay.
Like to know.
So yes, normal age women is anywhere between 45 and 55. Below the age of 40 is premature, but we have seen women going through the menopause in their early 40s. That's fine. And it is normal around the sort of perimenopausal. So as you're coming to the end of it, some women do get very heavy bleeding. And it's normally a combination of factor that they may have a few cycles that they don't bleed, and then and then the next one is a heavier one and lasts a bit longer. If you're at all concerned, or if you're unwell with those heavy periods, like you feel really unwell, dizzy, weak, and then it's worthwhile seeing your doctor to get to see if you've got you're anemic, or you need some iron replacement or something similar.
Magdalena Hall anauliza, amezungumzia Dr. Shayla, umezungumzia kupoteza nywele, yani upara. Je, kuna dawa ya kutumia ili nywele ziote?
Kuna dawa, ziko nyingi sana. Na ukiangalia kama una access ya mtandao, there is so many choices these days. Kuna dawa ambazo wanatumia wengine ambazo zinafanya nywele ziote. Kuna shampoo, kuna mafuta, and one of the things I would recommend ni kuonana na dermatologist au specialist wa nywele, kuambia kitu gani kinaweza kusaidia. But otherwise, kuna dawa za definitely there are medication you can have.
Okay, I think, I saw another question about whether you can buy a prescription. Can you buy over the counter, or you need prescription? I'm not sure what you meant, buy what, but can you remember, did you say anything about any medication? So I think she just wants to know whether...
Oh, can you buy over the counter, or you need prescription?
Yeah.
So do you come to Tanzania, you can buy over the counter. Sometimes I know that you can buy a lot of things over the counter.
Oh, yes.
Ni tofauti sana na Uingereza. So in the UK, estrogen cream is prescription only, but either vaginal moisturizer, which don't have any hormones. You can buy them over the counter. You don't need a prescription.
Okay, we're almost done. Nkundwe is asking, can menopause worsen migraine headaches?
Some people could very well get migraine headache, but actually most people tend to find their migraines get better after menopause, because most migraines are driven by the estrogen element of it. And you will find that most women who've got bad migraines are almost always related to their menstrual cycle, and therefore they find once they've got no periods, they get better. If your migraines are worsening after the menopause, it's worthwhile having a check, so to make sure that your blood pressure is not high. Because another thing, as I've mentioned earlier on, is once you go through the menopause, you've got a higher risk of having high blood pressure problems, and that may be one of the main things to rule out before you think it's just menopause.
Okay. Agneta has written tatizo ya nywele, Google alopecia, I think. I hope I pronounced it correctly.
There is a lot of things. Alopecia is quite there is many types of alopecia. So I'm not a dermatologist, so I'm not an expert on hair loss. I'll be honest, let's say that. And there are many causes for hair loss. And therefore you probably need to see what works for you. Most things that tend to happen is thinning rather than actually getting no para. Thinning is when you just lose loads of hair. When you comb your hair una maroon and it become thinner. So that's the most common thing. Kwa hiyo na alopecia ni ile ambao unapata upara ambao kwa vile unang'aa kama unaona kama vile wanaume wanapata upara wakiwa kwenye age fulani, and that's alopecia kwa wanawake. But in terms of the treatment, they really are dependent on the cause, and if it's driven by being postmenopausal, then sometimes it's just getting the menopausal period pass a little bit, and your symptoms get better and may just improve it. Or sometimes change of your shampoo, change of what you do to your hair, because your hair your scalp may become more sensitive because of the changes in your hormones. So by changing your shampoo, by changing what you do to your hair, so maybe not relaxing it, maybe not having tight braids, all those things that can make things likely for your hair to go.
Okay, so Dr. Sheila, we are done, 1 hour. Are you willing to continue? I can see we still have a number of questions. It depends.
I can continue for about 20 minutes.
Okay.
And then it's bedtime for my little girl and I have to, sorry.
All right, no problem. Mtu yote mwenye swali, tuna dakika 20. You can ask in English or Swahili, so both languages. Don't worry, be free. So Yande is asking, is it necessary to remove the womb after menopause?
No, absolutely not. You don't have to.
Yeah.
Unless it's actually there is something wrong with it, then no, there is no reason to. I know that people are not going to fall pregnant, but it's not an organ to have an operation just because you're in the menopause. But if you are having bleeding, unexplained bleeding after the menopause, or you're having a really bad prolapse, which I've explained, then it may be the treatment for it is removal of your womb and treating the prolapse.
Pole sana. Kwa hiyo kwa Kiswahili sio lazima kutoa kizazi baada ya menopause. Si ndio? Labda kama kuna athari. Okay. Jocelyn Tam is saying, please remember to mention when you are using these type of creams so we check any interactions. Am I right, Dr. Sheila?
Absolutely, Jocelyn.
Okay. Emson is saying informative. Agneta is asking, are there things one can do to prevent or reduce menopausal symptoms? Yes.
The things that all the doctors tell all their patients and all the patients hate. Lose weight, eat well, exercise. In those three things. There's a reason behind all those. If you lose weight, you're less likely to be bothered by when you had hot flashes, all those night sweats are less likely to be bothering you. As you know, the bigger you are, the more, if you get sweatier, the more annoying and the more disturbing it is for you. Secondly, if you eat well, so you avoid things that can trigger you. So spicy food, everyone gets really hot when they have spicy food. don't eat so late in the evening. Try and have your meals earlier on. Exercise and release endorphins, which are, feel happy factors in your body and hormones, and that is less likely to make you feel under the weather and sad and miserable. Also, if you exercise, you're more likely to sleep better because you're more likely to be tired, and you have a better sleep pattern than if you just don't. So that's just simple things you can do.
I forgot to read this question. Nuru was saying, any last word about menopause and weight gain? When you mentioned weight, I remembered that there was a question on that.
So yeah, yes. It gets very hard to lose weight after you're through the menopause. Again, there is a link about lower estrogen and making you more likely to be more insulin resistant. So I mentioned earlier on about as you get through the menopause, you've got higher risk of having cardiovascular problems, increased risk of diabetes, and all those things that I mentioned earlier on. Once you get to menopause, your body can hold on to things a little bit better. So you become insulin resistant. What I mean by that is, ukila vitu ambavyo viko starchy, like carbohydrates na nini, your body becomes better at making it all turn into fat. Whereas when you were younger, it did utilize it better. And obviously, as you get older, that does happen. And it happens from sort of third decade of life onwards and gets worse once you hit the menopause. So it's not unusual that you will struggle with weight loss. And you may have to change your appetite. When you eat, you may have to change your food. You may have to think about your portions. But that's the reality.
Okay, Magdalena Hall anasema nawezaje kuondoa kabisa tumbo la chini linalosababishwa na menopause?
Oh God. Tumbo la chini. It's okay. Kwani unafikiri tumbo la chini ni la menopause au ni la miaka ambao limekuwa worse wakati wa menopause? Kwa sababu kuna tofauti ya mawili hapo. Tumbo la chini, tumbo la chini sio la menopause. Wanawake ambao wanaongea through the menopause, they tend to have a bigger upper abdomen, so their body start changing. They get the shape kama wanaume wanakuwa na kitambi. So it's more that picture. So the bottom part, when you get a loose stomach in the bottom, it's more a combination of years of probably not doing much. You do get more loose skin, and you get loose muscles around your abdomen as you go through the menopause. And again, it sounds really awful. The answer is the same: exercise, especially strength training, so weightlifting and things that will strengthen your core rather than anything else.
So before I let Agneta ask her next question, can I just ask this from Frida? How often do you have these sessions? It's very, it's very informative. Okay.
We try monthly. I think this may be the last one for this year. I don't know if there was another one in that program.
I think there is another one.
There you go.
Yeah, I don't think it's the last one. Well, we'll see. We usually send some adverts every time there's a program, but it's once per month. We'll confirm, but as far as I can recall, I think there's another one. I'll try and check. This is, yeah, I think there's another one. Okay. But once I confirm, I'll come back to you. Agneta Karibu Sana, and I think there's a response from the chat as well. Agneta Karibu.
Yeah, asante sana. This is more of a comment and request maybe. I have had COVID twice, and I'm suffering from the long haul effects or symptoms.
Long COVID.
And, and currently my problem, and this might have resulted from a treatment I had, my bones seem to be brittle. And okay. I'm just concerned about the bones and the combination of the brittle bones and menopause.
Okay.
And I'm just hoping that you all, study these.
So what you should be on medication to replace. So everybody who's got brittle bones, which is osteopenia, they should be on medication to replace that. And it's normally a combination of calcium tablets and vitamin D. And you should be on something similar like that.
Yeah, right now, because this is just, still basically going through the diagnosis, because things are just happening.
Yeah.
I was my vitamin D was increased from 1,000 to 5,000,
okay.
And also calcium as well. So yeah, so I'm doing that. It's just that I just want to I'm concerned that moving forward, if once I hit menopause, things are just gonna, I'm just gonna crumble.
No, you can maintain. People do maintain that. So don't particularly worry about it. I think it's not going to help. You're already doing calcium. You're taking calcium and vitamin D. By the way, everyone should be on that. And I know that Tanzania watu wanasema kuna jua sana hapa, lakini I've been home. Najua watu wanakaa kwenye AC zao, kwenye magari yao, kwenye nyumba zao, wanakaa chini ya kivuli. Amna watu ambao wanakaa nje na wale ambao wanafanya kazi nje. So if you are spending most of your time indoors, in your car, and not out there, please take some vitamin D. It will make your life better and also improve your mood.
Oh, okay.
Thank you so much.
Thank you for that, Agneta. Lucy Lukaya anauliza, kwa nini siku ambazo period imepotea unaona tumbo limejaa na mwezi ikija tumbo linapungua?
So that is that's to do with the progesterone effect on your bowel, basically. So progesterone is the hormone that is high just before you have your period. Progesterone ni hormone ambayo inakuwa iko juu kabla hujapata siku zako. And as a result of that, inakuwa na effect nyingine kwenye tumbo na especially kwenye utumbo. Inafanya kwamba utumbo wako usitembee. It delays gastric emptying. It makes your stomach it makes your bowel more sluggish. And as a result, you have more gas in it.
Ameuliza kwa Kiswahili kwa hiyo.
Yeah, I'm trying to find the ways to explain this.
I know. Hivyo. Twende ataelewa na hii.
So, ukiwa na progesterone juu inafanya utumbo wako unakuwa unaweza kutembea polepole zaidi. Au unajaa gasi na pia kwa sababu umefika na ile siku karibu na mwezi wako na hedhi yako, kizazi pia kinakuwa kimejaa sana. The lining of the womb and the womb itself is full. Kwa hiyo unakuta as a result kila kitu kinakuwa a bit more bloating, kama unakuwa vile umevimba tumbo, and that's normal too. Unfortunately, there's nothing we can do about that. I'm sorry, I'm really terrible at this. I was trying, nilikuwa nataka nikujibu kwa Kiswahili vizuri, lakini nashindwa kujibu kwa Kiswahili vizuri. Nimeelewa swali vizuri sana, lakini sijui nitaleka vipi kwa Kiswahili ili ulielewe. Nisaidie vizuri.
Nadhani tulikuwa tumeelewa. Kama nimeelewa vizuri ni kwamba umesema ni hali ya kawaida. Kwa mtu ambaye ni karibu ya siku zake tumbo linajaa. Kutokana na ile hormone ambayo inaitwa
progesterone.
Progesterone. Kwa hiyo ni hali ya kawaida, hakuna namna yani hakuna namna. Na baada ya siku zako si huwa linapungua, si ndio?
Ni kawaida pia.
Kawaida. Kwa hiyo ni swala tu la kila mwanamke, si ndio?
Kabisa.
Haya. Kwa hiyo Joycelyn anasema very interesting talk, excellent explanation and translation. Asante sana Dr. Sheila. Na Rukia anasema thank you for the lesson Dr. Sheila. Na amini sasa maswali yametosha. Agneta, umenyosha tena mkono au ni ile ya mwanzo?
Sorry, ni ile ya mwanzo, samani.
Hamna neno. Kwa hiyo na dakika moja tu, Frida anasema how do we get to know the schedule for these sessions? One of my friends just shared a Zoom link today. Or is it specific for TUHEDA and EAE Foundation? I think it's been responded by, somebody has already explained on this chat. Once a month, they get advertised through TUHEDA and EAE Foundation WhatsApp groups. So TUHEDA, I believe, has a website as well. So they usually do put that advert. And we'll try our best to be sending, sending those adverts via WhatsApp as well. So basically, Dr. Shayla, everybody is saying thank you. I think people enjoyed the session very much, very educative. Yande, Victoria are all saying thank you. And I'm also saying thanks very much. I learned a lot.
No problem.
Yeah, I really do appreciate, and I think hopefully because many people were interested, we might have more sessions about menopause or even other women's health issues.
I think, so my interest, so I just want to share everybody, my special interest in is women health that people don't talk about. So my special interest is things like problems we have, women don't talk about, and that may very well be from after having children. So when people suffer from prolapse, when people suffer from pain during intercourse, when people suffer from problems with their bladder, even if they're also having problems with their bowels, those are the things that I've got a very special interest in. So things people feel very shy to discuss in public forum. And people know very little about. And one of those problems, people just think they're just their own and they don't want to talk to other people about. I know everyone think about, I think in gynecology, you hear about all the normal things. I don't have that because I think there's lots of gynecologists who do everything else. So if I'm quite happy. Also, I'm going to talk about endometrial ablation and menopause.
Okay, so that's for another day, right?
So you don't need endometrial ablation when you've gone through the menopause, so that they shouldn't go hand in hand. So if you're having bleeding after menopause, just have your womb removed. That's my advice.
Actually, can I just ask about that? Because a friend of mine had a problem with the bleeding.
Agneta, we're supposed to be closing now.
Oh, okay. We can talk about it
another time. One more for you. One more. Okay.
I'm just following up on that endometrial ablation because I posted in that. I posted it. So they had a lot of bleeding, and so the partial endometrial ablation was the solution, and that now has the effect of menopause, effect on menopause, and that's why she's actually taking that cream I mentioned, the Premarin. So
no, they all work together. So they are they're not those are not they're mutually exclusive.
Okay.
As in, the problem with the bleeding, she must have had it before she was menopausal.
Right.
So if she had a bleeding problem before menopause, then endometrial ablation is completely right to have that, but it does not cause dryness. So I think the two are not connected.
Well, the doctor is saying that if she had had a full ablation, it would have been worse. Her menopause symptoms would have been worse.
Nah. Okay. That's poor advice.
Okay. Just wanted to check, and that's why I'm here today.
Yeah, that's poor advice. So endometrial ablation has nothing to do with menopause. It doesn't affect your ovaries at all. So I think it's a treatment of the womb, and it's not the treatment of the ovaries. Your menopause is driven from the ovaries, and it's the ovaries that make the womb bleed. So if you just treat the ovaries, if you just treat the womb, the ovaries will just do its thing.
Okay, thank you so much.
So they're not together, and not one shouldn't be causing the other. I think she's just gone through the menopause. That's why she's got the dryness, and that's why she needs the vaginal cream, the estrogen cream, and that's absolutely fine. That's right to treat it that way. But to discuss that endometrial ablation would have made things worse. I don't think it's a right advice. But that's just my opinion, and I think my colleagues will agree with me.
Okay, thank you very much, Dr. Shayla Msami, who's a gynecologist specializing in urogynecology, who's in the UK, Newcastle. We really do appreciate, and I believe a lot of people are saying thank you and are appreciating. Till another time, as you are asked in the chat, anybody who wants the recording, please leave your email address and they will send it to you directly. Nashukuru sana Dr. Sheila Msami ambaye ni mtaalamu wa magonjwa ya wanawake, yuko Uingereza. Tunashukuru sana, nadhani wengi wamefaidika, wamefurahi na wameelimika. Dr. Hamza ananyosha mkono saa hizi na ndo tunaaga tena. Naomba tafadhali Dr. Hamza, unataka kuuliza kitu?
Tu kwamba kipindi kilikuwa kizuri. That was very good program, very educative, very informative. Ningependa mnapopata hizi linki mshare kokote kwa Tanzania na ambao marafiki zenu. Nimejaribu kuinbox watu mara nyingi, kwa hiyo watu wanakosa vitu hivi. Na hata recording itakuwa kwenye East African Education na TUHEDA. Hata ukiipata recording au link, please share as much as possible. Kuna watu wameuliza kwamba je, naweza nikashare? Please share as much as you can. Ni hayo tu, asanteni kwa organizer.
Thank you for having me.
Asante sana Dr. Hamza, Dr. Sheila, shukran sana na kutakieni nyote jioni njema. Have a lovely evening.